So my name is Jennifer Lundgren, and I am an associate professor in the Department of Psychology at the University of Missouri, Kansas City. And I have studied night eating syndrome since about 2004. Night eating syndrome is conceptualized as a delay in the circadian pattern of food intake. The diagnostic criteria include evening hyperphagia, so consuming 25% or more of one's total daily food intake after the evening meal, and or nocturnal awakening with ingestions of food at least twice per week. Individuals with night eating syndrome need to have awareness of their evening and overnight eating episodes, and it's often associated with other symptoms. To get a diagnosis, you have to have 3 of 5 that include morning anorexia, so a lack of morning hunger or a lack of food intake in the morning, depressed mood, urges to eat, and a belief that one needs to eat in order to return to sleep at night. The disorder must also cause, or those symptoms must also cause, distress or impairment in functioning in order for someone to get a diagnosis of night eating syndrome, and the symptoms need to occur for at least 3 months.
Jennifer, these people with night eating syndrome eat more at night, but what is it all over the day? Is it more or much more than other people?
So typically, if you look at the circadian food intake patterns during the daytime hours, so between 8 in the morning and 8 at night, people with night eating syndrome will eat significantly fewer calories than their weight-matched controls. This is especially true for non-obese individuals with night eating syndrome. But between the hours of 8 p.m. and 8 a.m., people catch up on their total calories. And so oftentimes, by the end of a 24-hour period, the people with night eating syndrome will eat about the same amount of food as the controls. In some studies of obese night eaters and controls, they don't eat any more food over the 24-hour period. In one study we did looking at non-obese night eaters, they did eat slightly more food than non-obese controls over the 24-hour period.
Jennifer, the egg or chicken question. Is it because people eat less in the morning that they catch up at night? Or is it the inverse? Is there some biological variation that makes people eating more because they eat more at night than
Yes.
they eat less in the morning?
I think in some ways it's both. I think for some people there may be some sort of predisposition, biological predisposition or lifestyle predisposition that causes them to skip breakfast. And then over time they eat more and more of their food in the later part of the day. And then oftentimes once the disorder has been established, what maintains it is that pattern of skipping breakfast and then being hungry later in the day. So oftentimes people will wake up and not be hungry because they have consumed maybe 500-600 calories over a couple of different nocturnal eating episodes in the middle of the night. So I think there's probably a difference between what initiates the behavior and then what maintains it later.
Jennifer, it affects 1.5% of the population, 10 to 14% of the obese, and also much more patients with psychiatric problems or eating disorders. We know that it is an abnormal way to eat, but is it really considered as an eating disorder? So
currently it's not considered an eating disorder. It's just an abnormal pattern of eating behavior that actually at different developmental periods of one's life might be quite normative. So in infants, for example, we expect them to eat throughout the night. In young adults, oftentimes they eat in the middle of the night because they're up engaging in other social activities.
Psychologically, how these people feel?
So there's quite a bit of overlap and comorbidity between night eating syndrome and mood and anxiety disorders. So about half of the participants that have been studied in different samples have a lifetime history of a mood disorder. One of the diagnostic criteria for night eating syndrome is a depressed mood that worsens during the day. But it for many years has also been associated with increased life stress. And so oftentimes people will just report maybe not that they have a depressed mood, but that they have a lot of stress and anxiety.
So these people do they fear to gain weight? And do they, if they don't gain weight necessarily, do they have reason to have this fear?
Yes, so a lot of people will say that they have a fear of gaining weight. And so in some samples, in particular obese samples, people do actually report that they gain weight in between when their night eating started and a later point in time. In one study we did of non-obese night eaters, they did not report weight gain over time, but they engaged in excessive exercising compared to their weight-matched controls. So we think that they may have been preventing weight gain through their exercise patterns.
So can we conclude that it's more fear than harm for health?
I think in many ways, yes. There's no evidence that really suggests night eating syndrome has any direct negative health consequences, but it does cause a lot of fear of people, not being able to fall back to sleep at night if they don't eat, or fear of gaining weight. A couple of studies have looked at the oral health consequences, and that is the one area where we do see people with night eating syndrome are more likely to have cavities and tooth loss. So I think the take-home message would be, if you are getting up in the middle of the night to eat, make sure that you're brushing your teeth afterward to prevent some of those cavities.